Hi, my name's Todd, and I'm going to be showing you how to do a blood pressure test today. So first thing you want to do is introduce yourself to the patient. Hi, I'm Todd.
Dylan,
Nice to meet you, Dylan. Second, you want to explain why you're doing this test to the patient for reasons such as testing for hypertension or heart disease to see if there's any abnormalities. You want to go over some protocol. You want your patient to avoid caffeine, alcohol, nicotine, and exercise a few hours before testing. You want to make sure that their body position is correct. You want to have your upper back against the chair, feet flat on the floor, and your left arm extended and slightly bent. Alright, we can begin putting the blood pressure cuff on now. You want to put it just above the crevice in the arm in line with the brachial artery. And I'm going to inflate this to 200 millimeters of mercury, and then I'm going to decrease it by 2 to 5 millimeters of mercury per second. The first sound that I hear, wherever the dial is, that'll be the systolic blood pressure, and the last sound that I hear will be the diastolic blood pressure. After you do the test, you want to communicate to the patient what the result is and what it means. So, Dylan, you had a blood pressure of 110/78, which is normal.
All right, hi, I'm Dylan. I'll be administering a test to find out the resting heart rate. First, you're going to introduce yourself to the patient. So, hi, I'm Michael.
Todd.
Nice to meet you. Next, you're going to state the test and purpose that you'll be performing. So, I'm going to perform a test to measure your resting heart rate. This will help indicate any abnormalities such as bradycardia, tachycardia, or any arrhythmia of such sort. Next, you're going to explain the testing protocol to the patient. So first, I'm going to have you sit regularly in your chair with your feet flat, back all the way up on the chair, and then I'm going to have you put your right arm rested on the table and not to completely rested. So you're not having to put any force or anything to hold it up. Next, you're going to explain. Next, you're going to begin testing. I'm going to start by find the radial artery, which is going to be on the thumb side of the right arm. When you do this, you want to use your forefinger and your middle finger to test it. Do not use your thumb because you can actually hear and feel your own heart rate with your thumb. So I'm going to put my left arm under so he's not resting or anything. Next, you're going to grab a stopwatch, and once you do find the heart rate and you can feel it, you want to start that stopwatch within a 15-second period, and you're going to count the beats per second for that 15-second period. So once you hit the stopwatch, you start it, you count it for that 15 seconds, and once you're done, you're going to stop the stopwatch and multiply the number that you got by 4, and that'll give you your resting heart rate, beats per minute, because obviously 15 times 4 is 60. So we'll start that now. That. Multiply, you can put your arm down. All right, your resting heart rate would be 68, which is very normal. Next, if they do have an abnormality, you need to explain what that falls under and what category, and if there's possible disease, and he needs to seek a physician of some sort.